we started in different places, we started putting technology. So now we have come to a stage where we are optimizing it. So, for example, we are using technology where the recall, let's use recall as an example. This year is a huge focus for us, is how do we ensure that the volume, especially the recall volume, where we have a medical liability, right, to bring them back in. And then what has been the traditional way? You maybe send a text message. Now you send an email, you may call them, or you send a letter, a postcard. People still do that, right? It's a rubber stamping, like so that I did all my three choices. So if the state comes in, I've done my work, but it's not closing the loop. So if they don't come back, there is no data around unless you are obviously, sitting on and tracking every patient to see, did the patient come back in? Did we actually do something about it? And so we are now using technology where AI agent is completely trolling through, and they can through all our medical records, and that can be done in 10 minutes actually. Even though we serve 500,000 patients, it can be done in 10 minutes. And then identify gaps of care. So it could be that a physician actually wrote in their note, instead of writing a recall, that this patient should come back in 6 months because they didn't get to do a colonoscopy for various reasons. They had some healthcare issues. They said, need to do a colonoscopy 6 months later, please call. But it's not in a recall section. So the team misses it. The AI agent reads through. It can be in your notes. It can be anywhere in the medical record, reads through, identifies, and then contacts the patient saying, you were supposed to come in 6 months, through a text message. That's the simplest. I think, people respond actually better with text than voice, even though the voice agents have become very good. Text message, do you want to book? Please, here's a link, go book a time, right? And so we have been able to do that even for recalls where the recalls have been closed. We have seen, and there's no schedule, patient is not scheduled. We can then go back and doing that. So that's now the next level of using technology to actually enhance, where there is still a human element, because sometimes there's complexity. We don't have time. All our physicians are overbooked beyond, right? There's a shortage in GI. So they will sometimes call, and then the front desk can optimize based on, like, okay, sometimes this doctor actually can see two patients at the same time. So we will double book them because they are bouncing between rooms, those kinds of things. But listen, that kind of information at some point will get fed into the AI agents, where the AI agents will say, this doctor has this preference, or afternoon of Friday, there's cancellation more so you can overbook the patient so that your utilization is 90%, because clinicians are your most expensive. Nurse practitioners and GI physicians are your most expensive resource. So that we are moving towards that. So that's kind of how we think about, is that we look at, okay, we have a problem. We knew this was a problem. We couldn't solve it 4 years ago because the technology wasn't there. But now the technology has advanced enough that we could partner with some of the startup companies and really shape the product as we want it to be. And that's what is happening. So it's been great to see how we could tackle certain problems across. And then ultimately, it has to have a positive ROI. This is not just pipe dream kind of experimentation. There's positive, it. If the patient comes back, has a office visit or even a telehealth visit, then comes back for a procedure creates professional fees, facility fees, creates anesthesia, creates pathology if cancer is detected, and finally it improves outcomes, because if we do detect cancer, we can quickly get them back out, versus if we would have not gone back and this patient, for God forbid, gets cancer, and it's a late stage, where GI cancer detection earlier it's not a death sentence, right? You can have a very long life now, and it's amazing how medical science has improved. So you can really improve that. So it has to have a good patient satisfaction. It has to have a positive ROI. It's not just an experimentation for the sake of doing experimentation.